Hi, in this video, I'm going to be talking about lymph nodes. What are they and why do they matter in breast cancer? Before I go on, I want to encourage you to subscribe to our channel. We put out new content up to 3 times a week. So what are lymph nodes? Let's start there. Lymph nodes are also referred to as glands. Sometimes you'll hear people talk about swollen glands in their neck, for example, when they have a sore throat and they're coming down with an upper respiratory infection. Lymph nodes, or glands, are shaped sort of like beans, like little tiny lima beans, and we have hundreds of them throughout our body. Our bodies are really quite remarkable in that when we need to, we can actually recruit more lymphoid tissue and get more lymph nodes. So after lymph nodes have been removed, we can get new lymph nodes. But it's important to know that you have hundreds and hundreds of lymph nodes all throughout your body. Lymph nodes are sort of enlarged nests, if you will, of lymphoid type cells. They have a capsule on the outside, and where the node joins the stream of lymphatics, that's called the hilum. It's a place where the lymph node will attach to the lymphatic drainage. And our blood is filtered both through the bloodstream, and then it sort of breaks off. The blood breaks away and is filtered through the lymphatics. If you imagine a canal filled with water and alongside it a train track, and they're running one another, they're parallel to one another, the lymphatics and the bloodstream are like that. And they run parallel to one another. And the lymph nodes are little extensions of the lymph channels that have a hilum, and then they have the lymph node itself that has a capsule. Under our arms, or the axilla, you may hear it called, under our arms we can have a handful of lymph nodes, up to as many as 44 lymph nodes. We don't actually know at a given time how many lymph nodes are present in a particular part of the body. The pathologist, who's the physician who takes the specimen or the part of the body into the laboratory and then examines that tissue for lymph nodes, is the one who has the final word on how many lymph nodes there are. Some pathologists will melt the fat between the lymph nodes and you can actually find more lymph nodes that way, but that's generally not necessary. So if you think of the lymph nodes in your armpit, and I'd love you to think about lymph nodes being above your collarbone, right up here. We have lymph nodes above both our collarbones in both armpits. And as the blood filters through the breast, and then that blood gets siphoned off into the lymphatics, some of that fluid will obviously go through the lymph nodes. If there are cancer cells that break away from the primary tumor, they go through the blood and or the lymphatics, and then they get sort of filtered out, if you will, by the lymph nodes. The lymph node's job is to catch things going through the bloodstream and the lymphatics. So I'm going to go back to the case of having an upper respiratory infection. When we have tender glands or lymph nodes in our neck, it's because those lymph glands are participating in the immune response, and they get inflamed and tender, and they catch germs like bacteria or viruses or other microorganisms. They can also catch cancer cells. So it's important to realize that lymph nodes are a normal part of the body, that they filter things out that shouldn't be there. And the reason they have significance in breast cancer is because of the following. If the tumor is such that the cells are able to break away, so a cancer in the breast has cancer cells in it that are able to disengage from the primary tumor and get into the bloodstream or the lymphatics and then get caught up in the lymph nodes, it means one of a few things. One is the tumor is active enough to do this breaking away. So it's clever enough, those cells are clever enough to migrate from the primary tumor into the lymph nodes. The other thing to know is that lymph nodes aren't perfect. They are not 100% effective at filtering all the cells and all the organisms. That's why we still can feel sick. Even when our lymph nodes are swollen, we're not cured of our upper respiratory infection. And just like with bacteria or viruses, cancer cells can also evade or escape the lymph nodes. So the lymph nodes are doing the best they can, but some of those cells can break away. Even if we scan you from the top of your head to the bottom of your feet, we can't say in most cases if cells have broken away. Now, let's talk about what lymph nodes mean in terms of staging, and then we'll talk about what it means in terms of prognosis, or how you're going to do. So staging, anatomic staging, takes into account a couple things. The first is the size of the primary tumor, and the second is the status of the lymph nodes, positive or negative, and the number of lymph nodes that are positive. When cancer cells have escaped the primary tumor and gotten caught up in the lymph nodes, they are said to have metastasized to the lymph node. I do want to make an important aside and say that this does not mean somebody has metastatic cancer. The pathologist uses the same term to describe cancer in the lymph node, meaning not in the breast anymore, as they would to describe it in other parts of the body, let's say the bone. So the stage of the cancer is in breast cancer based on the size of the primary tumor and whether or not the lymph nodes are positive, and if so, how many. So if one has a smaller tumor and negative lymph nodes, that would be a stage 1 or maybe a stage 2 cancer. We have separate videos on stages 1, 2, and 3 breast cancer that I'd love to refer you to if you want to learn more about the specific stages and also how we treat them. Stage 2 breast cancer is if you have 1 to 3 positive lymph nodes. I won't go into the tumor size, but there are tumor size requirements. And then stage 3 is when you have 4 or more positive lymph nodes. So you can see that the stage goes up the more lymph nodes there are. Again, we don't know how many lymph nodes the surgeon is going to take. The surgeon removes a pad of tissue and fat in which the lymph nodes are embedded. It's the pathologist who tells us how many are involved. A surgeon can tell us what they feel like and if they're worried about them, but they can't tell us if the lymph nodes are clean or negative. You know, I try to stay away from words like clean because they're value laden. So if something isn't clean, it's dirty. So I try to say positive or negative, and if so, how many. And then the pathologist can also tell us how positive that lymph node is. Is it a little tiny area or is it a bigger area? Are there tumor cells pushing out the capsule? Remember that lining around the lymph node? This is a really big lymph node. Lymph nodes are this big, but if the tumor cells have broken through the capsule, that sort of thing the pathologist can tell us. So I have covered what lymph nodes are, where they are in the body, how they're removed and counted, and what they mean for stage. What do they mean for prognosis? Well, it's important to know that even with negative lymph nodes, up to 1/3 of people, their breast cancer can come back in other parts of the body. I'm bringing this up because a lot of people have asked, with negative lymph nodes, I won't need such and such a treatment. And we need to know many other features of the tumor before we can give you a more accurate estimate of your likelihood of cure with surgery alone, the likelihood that the cancer will come back, and estimate the amount of benefit there is from chemotherapy or hormonal therapy, for example, targeted therapy. You know, all these therapies are meant to reduce the risk of the cancer coming back, and we need to know more than just a lymph node status to be able to tell you how much benefit you're going to get from treatment, because other factors play a role in breast cancer prognosis. So even people with negative lymph nodes can be offered systemic therapy because up to 1/3 can have their cancer come back in other parts of the body. We never used to give chemotherapy or endocrine therapy to people with negative lymph nodes. And then we learned that there are some negative lymph node tumors that do benefit from chemotherapy. If the lymph nodes are positive, we will recommend, in general, systemic therapy with chemotherapy, although not always. People with very few lymph nodes, like 1, 2, or 3, where the tumor has otherwise so-called favorable features, low grade, estrogen and progesterone receptor positive, and HER2, we don't always give chemotherapy to people with 1, 2, or 3 lymph nodes. There are usually other characteristics that go along with positive nodes that we will look for, like the estrogen and progesterone receptor status, the grade, and the HER2 status. Once we know all of those, if we want to send the tumor for a tumor genomic assay, that can give us additional information. So just like people with negative nodes can have a recurrence, it's also the case that people with positive nodes don't necessarily have a recurrence. Based on what I've said, you might be wondering, I have positive nodes, does that mean the cancer won't come back? And it does not. I have had people with double-digit nodes, 10, 22, 44, where their cancer hasn't returned. We have good therapies that can decrease the risk substantially. And we have people who come back 20, 30 years later whose care was with a different doctor, who are kind enough to come in so that we can tell our patients, I saw somebody just like you with positive nodes who is living free of disease, ostensibly. So I've covered a lot. I've talked about what lymph nodes are, where they are in the body, what they mean, how we use them for staging, and what they mean regarding prognosis. I hope this has been helpful for you. If it has, click like. That helps other people with the exact same questions you have find this video. As always, you can drop us a comment or a question below. We get back to as many as we can within the next week or so. And if you haven't already, subscribe to this channel. Thanks for watching.